A very warm welcome to each one of our participants who have registered for this very important talk. Dr. Johann is not a stranger to us. He is very much part of our discussions as CMAI in mental health. And the good thing is about his team is they always have a kind of a structured approach, keeping in mind both what is there as data for mental health in our country, as well as what is the Christian approach to this very important area of healthcare. So, Dr. Johann and your team, thank you very much for giving us your time this evening. I know we've talked a lot, but somewhere we need to take steps towards at least creating the awareness and moving forward. For us as CMAI, our mandate is to work with the church, and we give them the technical expertise or the technical understanding of anything to do with health and development. There has been many requests from the church, either from the church leadership at the diocesan level or even at the congregation level, just asking us for mental health initiatives, whether it's family counseling or adolescent counseling. So we've been exploring different ways of trying to get this across as a training or as an awareness. And today is one such step. And I really like the way Dr. Johann has given us a small synopsis of what he wants to achieve today. And one thing is this whole interface between the church and mental health. I think that's how he has expressed it, and I really like that. And looking forward to what you will be giving us as motivation, as a different kind of understanding when it comes to our responsibility as the church to take this or to address this gap in mental health. So thank you to each one of the UP and UK, Uttarakhand and Uttar Pradesh regional committee members for also taking the lead in this, and of course for Sumit. And to all the registered participants, thank you for joining. And I really hope and pray that this will be the first step of many more to come. We really need to take this forward in some kind of a structured way, and whatever is possible for your church or your institution in this area, please take it forward, even if it's one little step. I think it's important to start, and maybe you've already started, and how can we build on it? So thank you very much, and a warm welcome again to each one. And thank you, Abhijit, for supporting this whole initiative. Thank you.
Good evening, everyone. We are honored to have Dr. Johann Ebenezer as our resource person today. Dr. Johann brings a unique blend of clinical expertise and his innovative thinking in the field of mental health. As a psychiatrist with extensive experience in community mental health, Dr. Johann has dedicated his career in making mental health care accessible to and culturally relevant. He is the co-founder and director of healthSoch Academy, where he creates innovative health education courses for both professionals and public. Dr. Johann's background, is that he's also uh, designed something called Shifa Project, which really it's a model on community rural health and at the Padar Hospital in Madhya Pradesh. And because of this initiative, he was also one of the finalists for uh, BMJ South Asia Awards for 2016. And his academic credentials include serving as the academic lead for the mental health team at the Sense Education Unit, CMC Vellore, where he developed innovative programs for training and interdisciplinary healthcare teams. What makes Dr. Johann particularly and his team suited for today's discussion is his specialized interest in the interface between religion and mental health, which is at the very heart of our the webinar topic, and his expertise in online psychotherapy and community-based mental health model provides him with the practical insight into integrating spiritual and emotional care. Beyond his professional achievement, Dr. Johann is a musician with keen interest in history, theology, and philosophy, the perspectives that enrich his holistic approach to mental health. So please join me in welcoming Dr. Johann for this webinar. Over to you, Dr. Johann.
Good afternoon, everyone. Thank you so much for your welcoming words, Abhijit, and also to Dr. Priya and Sumit, and all others who have organized this webinar. I know that the doctors section and other groups continue to hold regular webinars in CMAI, so we really appreciate that you do a lot of work to keep these going. It's a very commendable job. So thank you for inviting us also to be here. So we're really happy to be here. I'll just very briefly introduce slightly differently. It won't be just a one-person monologue. We'll try to do this little in way so that it's easy for us to kind of look at get the concepts also, and also to have some take-home points as well. So I'll just be introducing all of them, and then we'll get started straight away. Yeah. So we are from healthSoch Academy. Yeah, we are from healthSoch Academy, which is an organization that has kind of started to. So that is our primary focus, and we are focused on. So I'll just introduce the rest of our team also, and we have Dr. Praveen here. I'll just bring him also up here. Yeah, so we have Sister Angeline as well. Let me bring her up as well. And we have Mr. Jobin. So, yeah, he's also here today. So I'm a psychiatrist by training, like Abhijit had mentioned. Praveen is also a medical doctor. He's a physiologist by training and also a neuroscience person. He's specialized in neuroscience. And Angeline is a nurse. Jobin is he's an engineer by training. So that's our team. So we're an interdisciplinary team, but our focus is on mental health in the community, both for the general public as well as for professionals. So that's what we are involved in. So today we are going to be doing this session with some dramas as well. So you're going to be seeing all four of us in different roles, and I'll explain that as we go along today. So what we're going to do is we're going to start first actually with a small drama, a very short one, just to get us thinking and to get us into the storyline of what we're trying to show today. Then we'll have a short bit where I'll be doing a little bit of a teaching session to kind of get us on the same page as to what we're going to be looking at today and what will be the objectives of today's session. And then we'll have a slightly longer drama after that, where we're going to be showing a kind of a consultation session, which I'll explain in a minute. And finally, we will debrief that consultation session and see what lessons we can learn from that in a very practical way. All right, so that's what we're going to be doing. And we have about an hour to do that. So we'll do it, try to complete on time so that there will be time for questions also. All right, so that's how we're going to be doing it today. All right, so what we'll be doing is we're going to be starting with the drama. So I'm actually going to be taking you through this story using the story of a family. It's a fictional family. It's not a real family, but the family is very much based in examples of similar families whom we frequently encounter in our work. So particularly counseling and therapy work, which we do, we have okay. So it's not meant to, point out any particular person or group. All right. It's meant to be basically a representative family. All right. So you have a pastor. Praveen is the pastor. All right. And he's the pastor of a church. And his wife, Angeline, is a psychologist. All right. And they have a son, Jobin. All right. That's what the roles we're going to be playing. And Jobin is presenting with a particular crisis at this point of time. So we're going to take a sneak peek into that crisis which he is undergoing. We'll just see how that is. And that's the first bit of the drama that we're going to be doing. All right. So let's start off with that. So once again, Praveen is going to be he's going to be playing the role of the pastor, and he's the husband and father in the family. Angeline she's a psychologist, but she's the wife and mother in this family. And they have a son, Jobin, who is now in college. So let's take a sneak peek into this family story, and then we'll move on with the discussion after that.
Jobin, is that you? You come home.
Oh, yeah.
Yes. What is this? Now it's not a holiday time also that you've come home. Praveen, do you know why he has come? He has come home.
He's come now. Let's come to the house. Why we should? He's come. Let him
This is so cool. Hey, what happened, Jobin? You all of a sudden that you've turned up home? I didn't know that you. What is the reason?
It's nothing, no big issue. I got suspended from hostel for.
What?
Yeah.
What is that you're so coolly saying suspended, Jobin?
Not only me, around 14, 15 students got suspended.
Let them be. Let them. There can be 20, 30 people, but why are you suspended?
Nothing. They found some
happening?
ganja. They found some ganja in my hostel.
Wait, Angie. Relax. He's telling him.
Ganja.
Tell
What is this? This can't happen in our house, yeah?
Some people are got suspended. It's me also.
What is this you keep on telling? Suspended 20, 30 people.
Some ganja, some small pack ganja they found in my room, and I got suspended. No problem at all. I can go to the college.
Okay. They brought let the others be suspended, but what it has got to do with you? And how did I bring you up? And how can you just come and say that I was suspended?
I have a lot of stress and a lot of exams. Work is going on, pending.
That is there.
So
that's how you've been in school, and you took up exams, and you used to be a very good student. And how did we bring you up, Jobin?
Don't say all those things. You people have time for all the people in the world. You just left me in the hostel. What all things say? All the people I am good and all. You people have no idea what trauma I have been through.
See, why did we put you in the hostel first of all?
You people have to, because
we both are serving God, and we are here working.
I don't believe in God at all. I don't know if there is a God at all.
What is
you people are saving people and all the people.
Your appa is a pastor, and you don't say that you do. I don't believe in God, Jobin.
I don't know if God exists. You people
Praveen,
just
what is this? You are just being quiet here, listening.
Angie, relax. Let him.
He just says that he has been suspended and he has come here. And that too, that is some ganja thing was in his room.
Ganja means everybody. It's not a big problem using ganja. It means I just use it to just relieve my stress. And
Jobin, I can't believe this is my son talking like this. Is this a way that I brought you up?
You cannot tell me all those things. You people just left me. You don't have any idea what all.
That is not the reason. Now you say.
Yeah, I can't do anything at all. It means no problem at all. You have time for saving all the people in the world. I never see you in my childhood. And all of a sudden you just farm my issues. I don't know.
Jobin, it's okay.
And this
relax.
is what it is. And Appa will be very goody, and he's there like
anything. I just live.
And being a pastor's son, and you say all this, and what is this? Praveen, you just have to listen to all this, and you have to quietly. I don't know how to quietly. Just listening.
You take a break.
I don't want to talk to you right now, Amma. This is the reason I don't talk to you at all.
Okay, Jobin, relax,
you don't want to talk,
Yeah,
and then you come home and you say you're suspended. And what is this?
I'm
Just
going
walking
for
out.
Bye.
Praveen, I really can't take this. How can this happen in our house? And
Don't
what is
make
the
a big
kind of
issue
work we
this.
are doing? And you being a pastor and I'm being a psychologist, and this is happening to our son. And how did we bring him up?
And what is the whole point of you sitting and shouting at him? See, anyway, he's got suspended. These things happen. He's in a college. He's a young person. You have to understand, no?
What do you
It
mean
happens
he's a young
sometimes.
person? And he can just do what he likes just because he's young. And I am really surprised at you telling this. And is this kind of values that we have taught our child?
Yes, all that is there, but then you have to give him some space. No, see, it's nothing. It's that he himself don't know. You get suspensions and all these things, hostel things. They are all young. He'll come out of it. Why we have to make it a big issue and all those things? And he'll come out of it and all those things.
No.
See, we are serving God, and it's very simple. See, we are serving God. When we serve God and take care of God's work, God will take care of our family. You trust him, you relax.
You keep telling this, but did we spend time with him? Do we spend time with God? Do we have prayer? Do we have devotions? And finally, you say God will hear, God will hear. And you don't have time at all for the family.
This is the thing. When somebody comes with an issue, see, you being the psychologist, you should be sitting and jumping, no?
What I being a psychologist, because I understand the depth of the problem, what he is in. And I don't understand how can you be so cool and calm and listening to your son talking. And ultimately, he's turning it out on me.
And again, I don't get why these Christian institutions are so strict about this. You have to understand, no? People can have, this all happens, no, in colleges and things, and all of that. That doesn't mean that he's going to be a big drug addict and he's going to do and all the things. This is all
and this is how it will start, isn't it? And me being a psychologist, I know this is how it will start, and it will go.
Yes, agreed. You know, as part of being psychologist and all that. Anyway, this has happened. We have to look forward and see, he's come. At least he's come and
look
told
forward,
us.
and if your son ends up being a drug addict and all this are fine with you.
We have not reached there, no.
And I don't understand.
Relax. You relax.
And he's just going. What relax? How can he relax when he's just been suspended and he's come home? And he just says, look, I'm suspended. There are 20-30 people who are also suspended.
See, what are we to do? We have to show Christ's love. So let's love him. Let's support him. Let's and talk to him. So instead of that sitting and jumping like this, how is it going to help?
You don't correct him properly, and you say like, we have to be loving him. We have to be patient with him and speak all this. Just because you're a pastor, you say all this.
That's the way. We have to be caring and supportive of them. Let's be supportive of him. Let's see him. He's not even ready to say. At least he's coming and telling us this. Half of the kids now don't even talk to their friends. He's at least coming and telling us these things. No. So let's give him some time and he'll come out of it. I think you're just overreacting. Come on, this all happens here in colleges and all. This all happens. You also have to be a little bit understanding. Young age and all. No? This happens sometimes.
This I don't know. I'm really worked up. Let me just go. That fellow is angry with me. Let me just go check with him. What is happening? Let me go check with. Let me just go check on Jobin. What is?
All right. So that's the first drama, just to get you thinking. So we will be discussing this family story a bit more throughout the session today. So just to start us off, just like Dr. Priya had mentioned at the beginning, today we are going to talk a little bit about mental health and the church. This is not going to be a class on psychiatry as such in order to, talk about mental disorders and all of these things. We're not going to be going into any specific mental disorder and how to recognize and treat or all these things. This is not also going to be a class on how to, identify mental disorders in the church and things like that. What we're going to be trying to do is look at how we can integrate the two areas and the relationship between mental health and the church. So that is what we're going to be looking at today. I know there will be lots of questions. We'll keep time for questions later. And it's a big area, so we don't propose to complete everything in one short session. This is more like a trigger just to get us started. And we're happy to continue these conversations and these questions later on also via email, or you can call us up or whatever. We can decide how we can do that later. So first of all, just to get us started, I think today in our contemporary world, we have a strong sensation as if mental health and the church are enemies. We have this very strong idea which has been developing over time, maybe the last 100 or 150 years or so, that we tend to think of mental health disciplines like psychology and psychiatry as something very much against the church. And the reverse also. The mental health professionals have often looked at the church as an antagonistic kind of organization. So that's an unfortunate thing. That's a rather new development in history, as we are going to be looking at today. It wasn't always the case. It's a rather new problem. Part of the reason for that is a lot of misunderstandings of history and a lot of misunderstandings of what these two areas are looking at. So I think to understand this better, we need to go a little bit back in time. And we have to look at historically how the church used to look at mental health. So for that, we need to rewind ourselves back all the way to the very beginnings of the church. And that, it's very fascinating actually. For that, we need to also sit and learn a little bit of terms. Okay, so I'll try to make this as simple and easy as possible. Let me start by, okay, use the chat box to answer. There is a Greek word which is very, very important to my profession. And that Greek word is psyche. Okay, so I'm going to ask Praveen to just write it down for you. Psyche, Psyche. Or the Greek pronunciation is actually suke. Same thing, we mean psyche. All right. So can you all put in the chat box what you think this word psyche actually means? It's a Greek word. It's not an English word. What do you think the word psyche means? Okay, I can see some responses coming in. Okay, I can see some people have mentioned mind. Carolyn and Kindanliu have also mentioned mind. Okay, Toby is also mentioning mind. Joan, right. We're seeing some mentioning, somebody's mentioning mad also. Okay, somebody's mentioning soul. Good, I'm seeing a couple of people mentioning soul. Okay, feelings, all right. Okay, good attempt. Now, unfortunately, today in our English usage, we are using the word psyche in slightly different ways from its original meaning. But the original meaning was actually soul. Okay, so well done. All those who said soul over there, very good. Okay. The word psyche actually means soul. Right. So for the Greek philosophers like Plato and Aristotle and all of the other Greek philosophers, they referred to the psyche as the non-material part of the human being, which is basically the internal experience of the person, whatever we experience internally. Right. So that is what was the psyche, as opposed to the soma, which was the body. All right. So in Greek language, there is this very clear distinction between soma, which is body. That's where we get the word somatic from. We talk about somatic problems and all in medicine. and the word psyche, which is the internal experience of the person. Right. And in Christian writing, the New Testament uses the same word, which is why it's important for us to understand it. The word psyche refers to soul. All right. So think about that for a minute. So the word psyche, which is the root word of psychiatry, the root word of psychology, right? Both these professions, the root word is psyche. So actually speaking, when you think of the word meaning, the field of psychology is actually the study of the soul. And the field of psychiatry is the medical discipline related to, problems of the soul. It's very interesting. All right. And psychology as such, let's ignore psychiatry for a moment, because that's basically the medical discipline which deals with behavioral problems. So we'll keep that out of the way for the moment. We'll focus on the word psychology, which is supposed to be the study of the soul. Psychology used to be a branch of philosophy. And I think this is very important to remember. All philosophy, what they felt, explained the mind or the internal experiences of the person. Right? So psychology used to be a philosophy. It still is. All right. Now, even more interesting, after Christianity came on the scene, right, from the time of the apostles and later on the early Christian church fathers and all, as Christian theology was developing, it basically began to interact with the philosophy of the early Roman Empire's time, the Greek philosophies of the time, basically. And eventually, theology began to encompass philosophy as well. This is very important to understand, because for the early Christians, for the first hundreds of years of the Christian church, theology and philosophy were an integrated discipline. They were not enemies. They were nicely integrated. And you had theology as so-called the queen of the academic disciplines, and philosophy was considered its handmaiden. It was like philosophy was the servant of theology, or not servant, rather, handmaiden was what was the term. Philosophy. Right. So the study of human beings and their mind and soul, the study of human beings and their mind and soul was part of philosophy. So this is an important thing to remember. All right. So you had psychology, which was a branch of philosophy, which itself was, kind of like the handmaiden of theology. And this was all one big integrated discipline. Nobody, for hundreds of years in church history, nobody saw these as different and competing and enemies and all of this. All right. And it also shows that the human being was considered as a single integrated being. It was not just his body as some separate thing, and his, the way he thinks, his mind as some separate thing, and then his soul as something else. Nobody thought of it that way. It was an integrated understanding of the human being. Now, gradually, over time, as as time went by and we came closer to our own time, the first split which happened was philosophy and theology began to drift apart. All right. And philosophers started questioning, not all philosophers, but a good number of them started questioning the existence of God and theology and all these things, and split off. So philosophy generally became a completely separate discipline. This happened about, around the 1500s and things like this, around that period of time, around the Renaissance and times like this. A further split happened, which is very important for our specific case. And then you'll understand why I'm going into this. Psychology split away from philosophy. So I think that is the next thing we need to understand. So by the 1800s or so, you're seeing psychology as a separate subject, the study of human behavior and the human mind, splitting away. And that's the environment we are now in. These three things have more or less gone very far. Very distinct and separate, and often look at each other as enemies. That's the current environment that we are in. So that's kind of important to understand. So this is the current situation we are in. And one of the fallouts of this has been that the church has gradually retreated from roles it used to play very much earlier. So if you see in the early church, the early Christian church, for many hundreds of years, many of the things that we now associate with psychology and mental health were things that the church used to be very much actively involved in, because it was the care of souls. So care of souls was very much part of the church's ministry and the church's mandate. Like I said, the word psyche means soul. So it was understood, for example, counseling, looking into family matters, family dynamics, right? Helping guide people as they go through various stresses and challenges. These were all considered pastoral care roles that the church used to fulfill. So what has happened now is that to a large extent, because of this new split where psychology and mental health has split off as a completely different discipline, the church has tended to retreat from these very crucial, important areas and has been kind of giving it off to, okay, I think that's mental health area. Let the mental health people take care of this. And therefore, there's been a big vacuum created there, especially for Christians. So who are people who are members of the church, who are part of the body of Christ, when they have these needs, there is a vacuum in the church to look at these needs. And they go to mental health professionals who are not necessarily oriented to dealing with these in the way that the church would. So it depends. Of course, you do get Christian mental health professionals, but even there are Christian mental health professionals who may not be very clear about how to handle these sorts of issues and how to take care of these things. So this is the challenge that we are seeing. And that's the current situation that we are in. So I just wanted to bring this up to you and to help you to think through this and the role that the church needs to play in reclaiming some of these areas, or at least becoming more involved once again and working along with the mental health professionals to do this. So it works the other way also. The mental health professionals have also realized to a large extent the importance of spiritual care in the patients' lives. So all mental health professionals now talk about involving spiritual care and spiritual support as part of the overall plan. So it's no longer a strange thing to hear mental health professionals talking like that. And it's also true that the church has woken up now and realized that this is an area that we need to reclaim and come back. But the question is, we need to see how these two can once again become reintegrated from a Christian point of view, especially when we talk about dealing with people within our own congregations and within the Christian community. I mean, that's the first area we need to talk about, because unless we sort out our own area, it's very difficult to go and talk about other areas. So that's what we want to mainly focus on. So we're going to now go into another drama. This is a slightly different one. We're forwarding the story now. Now, what has happened is Jobin has continued to worsen on his trajectory, and now he's fully into drugs and ganja, and he's become a dependent on it now. And he's come to me. I'm a psychiatrist who happens to be seeing him. He's my patient now. And he's okay. He's engaging in the treatment and slowly getting out of it. That's fine. But as part of that, I've decided to hold a session with the family members. All right. Because we feel it's necessary to bring the family into the story. So we're going to dramatize a session which might happen with his two parents. This is without Jobin. This is part of the counseling sessions that we may be going through. We're going to dramatize one particular session, just observe what happens, and after that we will debrief on some of these important points and just get some ideas of how we can, take some key points away from here. All right. Yes, so let me ask Kenji and Praveen to come back. All right, we're going to get into the consultation drama. Okay. Yes, Angeline and Praveen, thank you for coming today. And we have spoken many times before. Jobin is now doing much better. We're happy with his progress. He's been very cooperative during this initial period while we were helping him to wean off the drugs. And now we are gradually talking to him about, the various issues involved, how to deal with the challenges he faces, the triggers he faces that make him feel like drink it, but by taking the drugs and all. So as part of that, I thought it was important to speak to both of you. He has been telling me a couple of things about the family and how you all are doing. But I wanted to hear from both of you about what you think is going on, and also give some suggestions of how we can support him better and help him along his journey. So thanks for coming. So let me first ask both of you, how do you feel he is doing the past couple of weeks?
What you want to go ahead, Praveen?
No, you go ahead. You speak.
Okay, this is, I was really surprised, doctor, to see my son this way, because this is not the way we brought him up. And he used to be a very good boy, and I'm very sure that he will not get into all this kind of bad habits. And I was really shocked when, he got into this, and the way he has been involved in. I could not accept this at all, doctor. And I don't know. I'm taking the whole burden on me, and it's pressing on me so much, as if you're carrying the whole load on yourself.
All right.
Doctor, that's what I also keep telling her. I mean, we need to be supportive at this time. No, we need to help him, and I also agree with her that this is like an attack. Our kid, we have been serving God and following God, and I always keep telling her, no, we serve God. God will take care of everything. No, it's not like him. We have brought him and leave us a good thing only. It is an attack from the enemy who wants to destroy him and all those things and all. So we just need to pray and see how we can come out of this. And I think that's also needed. I keep telling her it's an attack. It happens, especially for pastors' families and all. It happens. So, but yeah, it is not his normal way to have gotten into all of this thing and all. So yeah, we need to pray and see. It's maybe a way of testing us.
Can I talk, Doctor?
Go ahead, Angel. Go on.
Yeah, he keeps telling it is an attack, and it is an attack. It is very obvious, like, you know about your son. And he went to college, and it's all his friends. How come he just gets into he says some attack, and then he just gets into a habit of taking drugs? And of course, like, there are friends, at this age, like, they get together, and his roommates, he was telling earlier that the ganja was in his room, and there were friends involved, and he doesn't know who are his friends. He says, like, it is an attack, and we still have to be supportive of him. This is how he has been telling earlier also. Support. And what support he's been giving. And ultimately, our son landed in this mess. And he needs to be set free, isn't it? There is so much of treatment and things are all going on. And what if he gets into some mental illness because of this? And he says, like, he's a pastor and he keeps telling, like, it is a Satan's attack and this is what has been making him to do. And how will we come to a conclusion?
This? No. See, you keep telling that, but then how else can we explain this? See, I am there and I need to take care. See, God has entrusted the parish and God has entrusted those families over there. So if I be selfish and think only of my son, who's going to cater to that? It is my responsibility. It is my mandate to go and help out them. And that's what we have to see. We can't go and keep monitoring our child, no, 24/7. He's now grown up. He's a young adult himself. He's grown up. We need to let go. And we just have to let go and God will take
and
control
giving
over the things.
Again, doctor, this is the way he says, like, he has to grow and this is the way you have to, and absolutely, giving so much of a liberty to him. He should be a father who's stern and who's giving following discipline at home. It all starts right there, and he was never there. He never spends time, even when he comes from a hostel, and he's fully involved in his work. Even when he comes, like, he says, like, I need to prepare for this sermon and that workshop and this workshop, and he goes there and he is so busy. And who will do all the work at home? It is on me. See, running a family is not an easy thing now. Who will do all the other works? And it is me who have to pay the bill. It is me who have to go around, run around and get the things what is needed for home. I need to look after, I'm so much worried leaving him in the hostel. We both dedicated ourselves for this work. And we wanted to come and serve. We came to this part of the country to work. And I'm also equally busy. And it's not a simple thing working in a hospital and, I too have patients. But I need to balance, isn't it, doctor? I'm balancing work and home. And how will I manage? And he doesn't even know that, I'm stressed and I'm doing all this. And he says, like, leave and Satan's attack. And, this is how we have to be supportive. And what can I do, doctor? You tell me.
Sure. Thank you, both of you, for sharing.
To do? See, that's what we have to show love. We have to show support. We are all fallen and we all have our mistakes and things.
Sure.
No, that's Christ has shown us that we have to love. And we have to show love.
You say you love, and this is the way our son landed up. You are seeing. And you say, still you have to love your son, still you have to, and if you're not doing this is what will happen.
Sure. Thank you, both of you, for sharing. So I really appreciate your honesty and that you've been able to speak up and tell these things. So we will talk about how we can kind of support Jobin and take these things forward. So thanks for that. Jobin has also been sharing a number of other things. He's spoken about, I think in childhood, for a long time, he was at boarding school. Is that right?
Yes, doctor.
All right. And so he was also talking about some of the stressors he had at boarding school and how he had some difficulties there. And he says he generally didn't want to tell and talk much about those things. Did he share those with you during that period of time?
He used to say it has been difficult, doctor. Like, just like any other kids, like boarding school is not an easy thing. Leaving parents and being there, like, it's never an easy thing at all. Like, they will have difficulty. And we have been telling, like, you have to adjust. And our work is important, isn't it? So that's why we made a decision to put him in the boarding school, because we don't have good schools here. And we want to put them in a good school. Education is important.
Sure. So you did send him to a school which, I know it's a pretty good school as well. I've also heard of it. But unfortunately, I think he did say that he had a tough time there. I think we can talk about that another time, about some of the challenges he was bringing up. But he did have a tough time there, he says. And he says you were generally quite busy and all in those days and all of that. And at school, there are new things as well. Angeline, as you were saying also, there are issues of peer pressure and things like this. From what I understood, he actually started his first exposure to these drugs and all the way back in school. So surprising, I know, but that's what he did come up with. The first time that he was exposed to these things was all the way back in school itself. So it wasn't something new that came up in the college time, although it was kind of reinforced in the college time. But it is, like you all know, it's not that he was a regular user in school. It maybe once in a while among some company and things like this. It became regular only maybe a couple of months back. You know that after the time with the suspension from hostel recently. So we're talking about only maybe a year or so where he's been kind of really a regular user. But the exposure happened quite some time earlier as well. And, I think he didn't really talk much about it and felt a little bad about it also on one side. But I think he found it difficult to share it with anyone anyway, not just with you all, with anybody else also. He wouldn't really talk much about these things. So that was a kind of a new discovery kind of thing at that, which we came 1 or 2 sessions ago that he was sharing. Yeah, he was also sharing, that he generally found, what to say, I mean, both of you are quite busy generally. So even when he used to come on his holiday times, he found you had work and other commitments also. So he didn't feel like sharing some of these struggles which were going on there. But he's happy to open up and talk about it. And I even asked him, are you okay to share this with you? It's with his permission only that I'm sharing this with you. And I think the next time we meet, we can have a session together also, where we can talk about some of these things. He's happy to open up about it and share. And thanks for sharing your thoughts on these things. And I hear you both got a point on, you've got good points to say, which I think I'll just talk about that a little bit. AJ, you were mentioning about peer pressure as a major issue, his friend circle and things like this. And I think the friend circle was the primary reason why he kind of got embroiled in the drug problem at the college. That seems to be also one of the major things that is making him continue. So that's a major area we need to talk about. And we will address that. I think that's a major area. We'll talk about that. And I need both of your support also for this, because you're the ones who know him best. You know his current friend circle, you know his old friend circle, and you're the right people who are there with him most of the time. He's going to be staying with you also for some more weeks, isn't it? At least till he's much better before he goes back to hostel. At least that was our plan. So he's going to be with you for some more time. That's a great time to kind of discuss these issues. This is an area where I really feel, Praveen, I think you can take, you'll need to take kind of a lead role here in this. Because, not just for young men, but even for young women, for young people, to a large extent, the role of fathers in guiding and explaining them through this is really important. And especially for him to have a good role model, a good male role model to look at, because he's not really getting that. He doesn't really have anyone in his friend circle or seniors whom he looks up to as a kind of a role model. So there's a big vacancy.
But doctor, I've always been supportive of him, and that's one thing. And also, I'm quite shocked that you didn't tell that. But one thing is, whatever happens, he used to come and tell me. And I was like a friend to him at all times and supported all of that. So that was what I think. But that's what I'm thinking. I'm providing that supportive thing for me. I'm like a friend for him. I'm allowing him to speak and things and all of that. Yeah, it is true. We are busy with our work and things and all of that. But when we are giving that time, I don't know. Yeah, that's a doubt I have. Like, what more we could do? We are providing for him. We are giving him a good school. Both of us are involved in God's work. We know God has told us to do this, and we are doing all of that. So, yeah, sometimes it's difficult to understand where did we go wrong in that aspect of it.
Yeah. So thanks for sharing.
Another thing, doctor, like he says, like he's
Yes,
being loving,
yes,
being
Angel.
a friend, but disciplining is, I don't agree. Praveen did that because he's too friendly, too loving, he has to be strict, isn't it? It should have anyway, but it should have started earlier. But he's been giving so much, he has to be a loving dad, and just because he's in the hostel, when he comes home, like it's all, I need to love him, and that is the way it has been. And we are reaping the consequences.
Sure.
Yep. Sorry.
Sure. All right, Angel. Thanks for sharing. So, Praveen, yes, I do agree that, you are a supportive family. So please don't misunderstand when I'm saying that. You have supported this boy. You have educated him well. He's got into a good college. You're providing for all his needs. And you have brought him up in a very good way on the whole. So we're not looking at a dysfunctional family that has completely, not been good. So that's not what we're looking at. We're looking at how we can improve things a little bit more in certain areas. So please don't take this as that you're not supportive, and all you are. And I think that's good. But I think the support he needs is not just in terms of a listening ear and friendship. He needs also a lot of guidance and role modeling and correction. That's also part of the support that needs to be given. And, parents are the right people to do that. Now, I don't know, I have not seen you as a family in the past. I'm only hearing what all of you say. But it sounds like, to some extent, there's been some slight discrepancy between both of you about this. Am I right? Slightly different viewpoints on how, this kind of guidance of children and disciplining needs to be done. Am I right?
Yeah. I think, Doctor, even though she's the psychologist, I feel she is an old school person. We now think of, see, again, discipline, she says you have to be strict and all those things. At least that's what I keep telling her. At least she's coming and telling us these things. Nowadays, kids, one thing leads to another, one shouting and all, they just go and who knows what all they'll do and commit and things and all of that. So I feel she's very, old school enough kind of thing. We need to look forward and see the culture is changing. The boy is not like our childhood and our thing. The young generation is different. So we need to adapt to that. So I feel, and I think that is where our difference of approach is. So I feel you have to move along and adapt to the new culture and aspects of it.
You keep telling it is old school and things like that, but how come these we have to come and see the psychiatrist? We need some medical help. He needed that, and I've been telling all this earlier also.
Yeah. That's fine. So Praveen. So I think we probably have to go a little bit more into details on this. We'll need a couple of more discussions to talk about this. But I think one thing we've got to make pretty clear is that, disciplining kids and guiding them is never old school. So I think, now we're all Christians here, all three of us, so we can speak freely from our worldview and from our point of view. And you as a pastor also very well know this, that, the Bible is extremely clear on some of these things as to how we need to train a child in the way he should go. And so do some of those, and sometimes we need to be clear and firm and directive in the way we do that, even if it's not pleasant for the child. Now, that does not mean we have to be cruel, but it does mean that we have to be clear and consistent and, guide them with clarity. So I think that's That's the way we're talking about. We're not talking in terms of being cruel and shouting and, putting them down. That's not what we mean. More in terms of being consistent, clear with clarity on how we should go ahead, being clear in the way we give messaging and consistent about it. We don't have to be cruel. But then if we're going to just be, be nice to them and let them do whatever they like and try to just be friendly with them and support them without giving them those other aspects of clarity and being clear on these things, including things like boundaries. Now, for example, in this particular thing we're talking about, friend circles, we may have to gradually have some conversations about who would qualify as a good friend and who would not. And the difference between friend and acquaintance. It's okay to have, everybody's an acquaintance. We know a lot of people, but everybody need not become a friend. And even among friends, who are going to be the closer friends versus the not so close friends. So these kind of conversations will involve certain clarity on our part that we'll all have to be consistent on. So if I say something and then you say something opposite to that, or if both of you have different conceptions on this, that's going to confuse Jobin. And Jobin is not going to really pay attention to anything we say, any of us say for that matter. So right now, because he was in such a low point and he's coming out of that, he's now very open to these discussions. He's ready to talk this. So we need to take this moment, seize this moment, and look at how we can, present a united front to him about this and be clear about it. And this is a good place to start, even if it is talking about his friend circle and how we can move ahead with boundaries and things like this. That's one good starting point in the discussion. And that was also the primary area that is leading him back to drugs. So I think it's a strong area to attack on. Now that you mentioned attack, Praveen, I want to just bring that up. I don't want to tell you straight away that, no, I don't believe in the devil, because I do. And I think, we have to be aware of spiritual realities and all these things. And attacks are a very real thing. But the only thing I differ with you there is, I don't think the attack was really the drugs as being the primary place where the attack was. I think the attacks are more or less happening, as they are in a lot of our families these days, on the family itself. And not just that, okay, the drug was a attack that came up and all. It looks more like, the attack has been one on the family itself and your dynamics, your relations, the way you've been handling with each other and all that. And that's where we need to, concentrate our efforts on. So, I know you're a pastor's family and you know this very well. I'm sure you must be doing devotions as a family daily and praying for each other and all of that. Isn't that right?
He has to answer.
So, usually that's what we are busy with, the schedules and things and all, and all. And we are always keeping praying. We pray on for each other individually and all. But then, the time is not there. So,
there's no time for family prayer, doctor. I'm very sad to say that. We've been having faith in God. And I'm so shocked when my son said, is there a God, and he doesn't believe. This is a kind of a thing that is happening. And he's happily going around, sharing the word, busy with his work. Family is important, isn't it?
Sure. So thanks for sharing. So I'm glad we could bring this up. So could I just suggest that, as a family, as we go forward in this, that we'll try and make sure that we have some time for regular family devotion every day as a start, as one of the starting points that you can do from your side. I've given Jobin a whole set of starting points he has to do from his side. And he's, working on that and seeing how he has lots of agenda items that he has to work on. But can we try and see that as a family? Praveen, can I put that on you, that you'll see how you can try and restart family devotion, even if it's for a very short time? regularly as a point. And that will also be a kind of sign to Jobin that there is intention from all of our side also to work and make some changes. Because that's, I think, the thing that he's facing. He's feeling that why only I should do the work? Why can't others also change? So if we can work on this. So do you think that's something we can just start off and see if we can try and do it sometime in the day, either morning or evening or whichever time works for all three of you? Would that be something you could do?
Yeah, I think we could try. Anyway, I've also been feeling we need to pray more and see. Maybe this is God's way of saying to us, we need to start. Yeah, we can see. We can see something.
All right. Thanks. So I think that's a good way, I think, to conclude today. We'll meet more. Like I said, we'll have to have a couple of discussions like this. So I think we're meeting next day after tomorrow, right? That's when we're meeting next. So that time Jobin will also be there. That's Jobin's regular review. So I'll see him as well. But I think the three of you, we can see it together. Jobin is ready for that now. So it's the right time for us to now bring this up and see how we can go. And we'll focus our attention primarily on the peer pressure issue. We'll start with that. Next couple of sessions as a family, we'll see how we can navigate this and make these decisions, these very difficult decisions. They sound easy. They're not easy. We know college students have a very tough time navigating these. So it's something we really need to talk about. It may mean him having to say goodbye to some very thick friends, or at least reduce his connection with them. It might mean having to find new friends. So it's a big task. We'll take it one step at a time. All right. So thank you once again for coming, and we'll take this up.
Thank you, Lord.
Thank you.
All right. So we're out of the drama. Yeah. And we'll just spend a little bit of time debriefing what we saw. I know there's lots that came up, and I'm just going to take about 5 minutes to debrief and kind of like help us to understand some of the things that came up. Now, as I said, we're not focusing today on the mental health issue as such here. The mental health issue here was very clear. It was the addiction problem. Correct. So that's a pretty straightforward mental health issue. It's a common mental health issue, very common, especially among youth and college people and all. It's an increasingly significant problem, but that's not today's topic. So addiction was there in the background, but you also see that wasn't the only problem in the story. So now remember, me being the medical professional or the mental health professional in this story, how did I interact with this family? They came to me primarily because of the addiction issue, not for anything else. Correct. So we had a medical issue to deal with. Probably he had severe withdrawal symptoms or some other medical complication for which they came to the hospital, and he underwent treatment. He's now better. He's off the drugs, but he's struggling with the issues of how to stay off the drugs right now. So that set of work is going on with Jobin. And that would be something we would normally do, right? But while doing that, we also came across many family dynamic issues which are complicating the story. I think that's one key thing over here. So what are some of the family dynamic issues that are complicating the story? Would anyone like to put it in the chat box? There are quite a lot of them, but whatever you can remember from what you saw. What are some of the family dynamic issues that were complicating this story? All right. Yeah. Unbalanced parenting, accusations. Yes. Both parents are happy to accuse each other and point out mistakes in each other's conception of parenting. So the unbalanced parenting, yes, absolutely. Will anyone like to tell me what particularly was imbalanced about this parenting? What was unbalanced in the story?
Working in the family.
Sorry? Yeah, in the family. What was unbalanced in
Work
the
and the family. Work and the family.
Right. Work and family was unbalanced. It was unbalanced in another way also. That is, the father was really very much retreating from his role. And I think that was one of the key things that came out in the thing. And that led to the mother kind of overcompensating and ending up struggling because she was trying to play the roles of both parents simultaneously. Now, they are both busy people. We are not saying they're free. They both have full-time jobs and obviously are very much involved with ministry work. So this is not a couple who is free, right? But you see that the father, even when he was free, did not really take on the role that he should have been taking on fully. We can debate that more, but certainly that was at least the perception that was coming out. And it ended up the mother having to overcompensate a lot for that. And therefore, this led to a kind of imbalance, and she was more stressed, more irritable, and that was coming out in a lot of anger to everybody, really rooted in the fact that she was being overstretched and having to take on two roles, or rather trying to do the role alone. Then yes, I can see a lot of other points, a lack of consistency in parenting, right? Lack of understanding each other as spouses, right? And so good. So all of this is there. And yes, they have completely different models of how to deal with things. The father's model was, no, let's just be nice and friendly. And okay, the idea of me spending time with my child is just to be nice to him all the time and keep always be supportive and affirmative and all these things. There is a place for that, but I think the father was doing only that, which was the problem. The mother, on the other hand, quite rightly felt that certain, boundaries, disciplines, ideas needed to be told. But I think in her overcompensation, because of the lack of the father playing his role, she ended up going a little extra in that direction. And only doing that, and only being angry and irritable when she couldn't enforce things properly. And we don't have time to really go into, there's a lot of new research which talks about the differential role of father and mother in parenting. We don't have time. It's not our topic today. But just to tell you that both father and mother have very different roles. And this is not just from our Christian worldview understanding. A lot of research, recent research, has actually shown the very critical importance of fathers in parenting older children. Just like there's a critical importance of mothers in parenting very early young children. So up till about 3-4 years, the mother is the critical parent. But after that, particularly as the child approaches adolescence and later childhood, the father is the more critical parent. This is something we all miss. So there's research to show that when there are fathers who are not playing their role, there is greater chance of suicide in the children, greater chance of substance use, greater chance of mental illnesses, greater chance of crime, greater chance of sexual problems in both boys and girls. All the problems which we see in young people of today can boil down to the fact of, absent father. So it's a shocking revelation that the research has shown us. It's not just what our Christian worldview has always been telling us. So when the Bible actually says, fathers, discipline your children and bring them up in the way of the Lord, it really means that. Because God has created the family with the father having a very serious, important role. And these roles are not seen, these issues are not really seen when mother is absent. It's not to put down the role of the mother. It's just to tell how important the role of the father in parenting is. And we can make a similar case for the role of mother in the early childhood, first 3 to 4 years of life. The mother is irreplaceable. But what has happened in the modern society, and the church has also started doing this, it's been telling mothers, it's okay, you can go back to work immediately. As long as grandmother or as long as a nanny is there to see the child, you can get back to work immediately and go and don't really bother with the child. And what have we been telling fathers? Well, your role is to work. The ministry is there. We have to do this and we have to do that and keep doing. So we've been indoctrinating parents, both mothers and fathers, to do exactly the opposite of what they should be doing. So in terms of parenting. So is this just to show you that research also backs up what the Christian positions on this have always been. So this is just one example of that. So I'm sure we can talk a lot more. We're kind of out of time. So we focused our discussion primarily on family dynamics today as one area where you can see a huge overlap area between, the Christian church and the mental health professionals, especially when we're dealing with Christian families. We'll start there. I mean, obviously these have overlap with when we deal with families outside the church also. But let's start with our own first. Let's start with our own homes, our own communities, our own congregations, our own staff. We have enough issues here. And everything that we brought up in today's session were actually inspired by actual therapy sessions that I've been doing in the past couple of months with Christian families, many of whom are leaders in their churches and things in various parts of India. So these are not hypothetical stories. These problems are very real in our Christian homes, and the attacks are very real. And we have to wake up to the fact that we need to get back to Christian principles of family and use mental health principles which are in accord with the Christian worldview, which are a lot. By and large, majority of our mental health approaches, a good number of them, have many things which are in accord with the Christian worldview. There are some things which diverge and we should be careful there, but majority of it very much falls in line with how we would like to do things with in a Christian way. So the challenge is for us to use our Christian understandings of how to do this. So the challenge here is not to learn psychology and psychiatry. The challenge here is for the church to get back to the biblical principles of managing family, because most of them fit in very well with what the mental health positions on these should be. So that's where I want to just probably wind up, and we'll open for questions now. So I'll ask if there's any questions, Abhijit, we're happy to take them. And I know this is a big topic. We'll not be able to cover everything today, but we're very happy to take up a few questions, and we can continue these conversations later in various other platforms and ways. Over to you, Abhijit.
Yeah. Thank you so much, Johann and your team. It was an incredibly insightful and engaging session, and particularly the use of role play scenarios. So request all the participants, if you have any questions, you can post them on the chat box. So some of the things, I have some questions which I had thought of prepared already based on, I think, some questions also we've received from the participants, but based on your presentation today. So I was just thinking in terms of, we'll post, we'll put all those questions which have been posted during the what you call this registration little later. First, just wanted to check with you based on your the presentation. How do we establish a consistent messaging when multiple caregivers? Now you have friends, the family, healthcare providers, spiritual leaders, all are involved in the mental health journey of a person. So how, because that person is listening to so many people.
That's right. So thanks. That's a good question. So I think one key thing will be to identify who are the primary carers of the person, and focus our attention first on them. Now, for example, in the case of Jobin, it's very clear his parents are still his primary carers. He's not married, so he doesn't have a spouse. He's young. He's still their responsibility. So they are clearly the carers. So we need to keep them as the primary focus. And that's part of what the session I kind of tried to show there. The importance of bringing the family or the relevant carers into the story while we counsel and work with these patients. And this was part of that. You saw that there were a lot of differences in opinion, but we have to see how we can come to a same page. That is very crucial. So that's part of the work, I think, of the Christian care, healthcare provider who's working with this. Whether you're a pastor or a psychiatrist or psychologist or just any other medical person who happens to engage with a person like this, part of our role is to identify the carers and also bring them on the same page. If you're dealing with a Christian family, I think unabashedly we should be using our Christian principles in how we do that. Even when we're dealing with non-Christian families, I think it's important as Christian caregivers, we follow the basic principles that our Christian worldview puts forward. Now, for example, if you have a family that, where there's, marital discord happening and one person is having an affair. And as a Christian caregiver, it's important that we tell them right at the beginning that if we want us to help you as a family to get back, this affair cannot continue. And I think we sometimes need to be a little clear about some of these positions, even at the risk of losing them as potential patients. Because the reason being that if we compromise, then that's a foothold for the devil to come in and do all sorts of things. So one compromise is enough, really, for us to push down the thing. So I think that's the key principle we have to keep in mind. So I hope that was helpful.
Thank you, Johann. And it's also when someone is in a vulnerable state and very open to discussion. So what are the ethical boundaries both for the professional healthcare provider and the spiritual caregiver?
Okay, you mean ethical boundaries in what sense, Abhijit? In terms of
when someone comes and talks to you, I mean, for right now in this scenario, we saw as a professional, they went to you as a professional, so there is a ethics there. But when they go to a spiritual caregiver, so what all, is it similar or it will be different, or how do, what are the boundaries there?
All right. So you mean like not necessarily a medical person, a non-medical person who's providing spiritual care for the person?
Yes.
I think that's a great question. I think, again, I think it is helpful for the person to remember what his role is. He's not the relative of the person. He's not the pastor of the person also. So I think that is one key. He might be. If he is the pastor and playing that pastoral role to the person, that's a slightly different role. The relative advising and talking to someone is a slightly different role. A friend doing it is a slightly different role. So I think the person has to first realize what is the role he is playing in that person's life and what is the context, and keep all those boundaries also in mind. And second thing is, I think we should be able to listen to each other and make sure that he listens well before he jumps and gives his opinions and solutions there. So if you notice, even in the session, although there were a lot of things that I did not agree with both of them, we actually gave them time to speak. That's important because then you will hear exactly what they actually believe and what they are actually thinking. Only then can you try and either challenge that or agree with that or modify that. We can't do that unless we have fully heard them. So that's an important principle, I think, in any kind of caregiving. They need to listen and hear what everything is before they jump in and try to provide solutions, especially in these kind of areas of family conflict and things like this. Now, as spiritual caregivers, this will not be the only areas they are dealing with. They will be dealing with lots of other areas and questions and all those. But when they are dealing with issues of family dynamics, stress, mental health and all, important that they listen first. They may feel at times they need help to deal with it. It is quite fine that they can also refer and get others to get a pastor to get involved or get a doctor or a psychologist to get involved if needed. Again, they can only do that if they have heard the whole story properly. I think that's what I would suggest.
So there is one statement here in the chat box. The attack of the enemy is mainly on the family, of which we are aware of. are followers of Christ. Unfortunately, the church of today has a little or negligible influencing capacity on the family as a unit. Would you agree?
Okay, great question. I saw that in the chat box. Little bit I was itching to answer that question. So thank you. I completely agree with that point. I don't think, again, this is my position on this. I think Praveen and NG and all would also agree with this. I don't think the attack on family is a new attack. Because I think right from the very beginning, okay, the family has been a major battleground for this attacks of the enemy. Part of the reason for that is that the family, particularly the married couple, has been instituted by God as a sort of like an image of himself also, and also his relationship with his people. So the family basically it's a representation of Trinity on earth. It's a representation of God and his people, husband and wife, the Christ and his bride, God and Israel. So all these images they're all family images, which we understand very well. And that's the reason why God has placed the family there as a solid institution, because that's the way he communicates this to everybody. Even to those who don't have the scriptures with them, they see the family as a wonderful institution that they can learn from and see from and derive a lot of good from. So this has always been an attack of the devil. And right from the beginning in the Garden of Eden, it starts, the first attack was there itself, where again you see a husband who was not playing his role. We all talk about Eve having eaten the apple, but then at the time of the eating of the fruit, Adam was also with her. There's actually one of the verses actually says she gave the fruit to her husband who was with her, and he did eat. So what was he doing there at the time when he didn't play his role of being a protector, of defending her, of correcting her, of encouraging her, of keeping her safe? He didn't do that role. And finally, there you see itself, all the problems starting there. And so this has been a consistent attack all the time. It's nothing very new about it. The attack has taken different forms at different times in history. There's some nice, people, scholars who talk about this is just again, a little bit of history here. If you look at the medieval church, the pre-Reformation church, there was a belief that celibacy was the highest thing a man could do. All priests were expected to be celibate at all times, and not just priests. It was generally believed that celibacy, not being married, abstaining from sex in all ways, was a very high goal. And many scholars pointed out at that time that one of the problems with that is it's an attack on family. Because if you don't get married, you won't have children. And if you don't get married, no children, the church won't grow, and it's an attack on family. So it's very surprising, but that can also be one form in which the attack on family happens. Today, we are seeing a very different attack on family. It is the whole LGBT story and, the thing of, you don't have to have one man and one woman to get married. Any combination is okay. And you see another attack that you don't want to have children either, because children is no longer one of the key aspects of marriage. So it's a different sort of attack. But it's the same principle. Whichever way he wants to do it, he will attack the family. And in India, in particular, we have a very unique attack on the family, which is this whole joint family story. The biblical model of family is very clear. It is man leaves his parents and cleaves to his wife. It is not everybody cleaves to the rest of their family forever and ever. There is this idea of leaving and cleaving. So it doesn't mean we throw away our parents and our family of origin, but there has to be a hierarchy in this. Our spouse is more important than our parents. The order is spouse, children, and parent. In our Indian joint families, it's often parent first, then children, and spouse last. So you can see we've inverted the order. So again, that's an attack. So I think the attack on family has always been a critical place, and it's the place we need to be most careful about. And I think we all need to think and really pray, and the church as a whole it is doing, but it can do lots more to encourage Christian families, even among frontline workers, the pastors, missionaries who are frontline workers. The tendency has often been to neglect family because they think they're doing God's work and families can be neglected. But I think it's really important that we know that we are responsible for our spouses and children first before anyone else. So there's just some thoughts there.
Thank you, Johann. I think there's also in the chat box, I can see Reverend Dr. Seth Masih has given some insights on why does Satan often target the family and what can be done. Thank you so much, Reverend Dr. Seth. If there are any other questions, I think, yeah, there's one more question is, I think there's the lack of emotional needs of the child is missing in the drama. So my question is how to understand the emotional needs of the child.
Thanks. A big question. We may not have time to fully go into that, but I think it starts very much with giving time. And I think, like you said, that was missing in the drama because it was also missing in this family story. They didn't really give time to this child. And now he's no longer a child. He's now in professional college. So strictly speaking, he's no longer a child. But yes, that the vacuum, there was a big gap in his life because of that. And he said so also. The child kept telling that. And in fact, in the original, the first part of the drama where that fight was happening, that was one of the things he was fighting and saying, that you don't have time for me, you never had time for me. And that was a general accusation, which was true also. And they also finally sent him off to boarding school. Now that is plus minus. I don't want to get into that discussion about whether that was a good or bad thing. But the point was, even when he was on holiday and back in the home, they didn't really have quality time. And they didn't even have quantity of time. They didn't have any time with him. And, you know, he really kind of missed that. So it boils down very practically to spending quality time with children and understanding them. I mean, without time, you can't do anything. Of course, there's lots more we can talk about of how we can know the common issues that children face at different age groups, developmentally, and all of that. But we don't need to go there. But none of that can happen if we don't actually give time. And that is the tough part we have, all of us face. That time is really a problem. Kids are also very busy these days. So it's not just our fault only. Kids have lots of schoolwork and homework and extracurriculars, and they are sometimes having a bigger schedule than the parents are having. So it's a challenge that we need to really work out how to find quality time with the kids. But that's really important. And that was missing in this family. This family need not have cancelled his boarding school and kept him at home. But they could have done something to spend more time with him in his holidays. They could have taken some time off or intentionally done things with him or visited him more. Maybe there were things they could have done, even given this, even if they didn't change what happened. So, and going forward, that's something they can do. Even as this child is now struggling with these things, they can start finding time for him and keep time for him. Yeah.
One question that I want to take from the questions that we've received. I know that we are short on time, but just one question I'll take, and the rest what we'll do is we'll share it with Dr. Johann and see if they can answer, and then we can send it back to you. One is how to integrate, the question is how to integrate mental health into church activities. Any examples?
How to integrate mental health into church activities?
Yes.
Okay, great question. Right. So I think the one good way of doing that, I think I'll say two things. There's so many ways, but two at least I'll say. One is, I think, getting leaders of the church, whether that is pastors or elders or, other people involved with different ministries, including things like Sunday school, choir, youth ministry, men's fellowship, women's fellowship. All of these are established things which happen in most of the churches. getting all these leaders little bit oriented and accustomed to some of the things that are mental health concerns. Now, like I said, majority of these things were always concerns of the church earlier. Things like, struggles that youth face, things that families face, marital problems, sexual problems, suicide, the problem of temptations. All of these are very much, they were always very much part of church roles. And leaders generally were quite accustomed to these things earlier. But now, because this has all been relegated to psychiatry and psychology, it's no longer part of the training and understanding that church leaders go through. So it's a question of reorienting church leaders to this so that they are also able to incorporate this into their regular things and all. For example, the regular Sunday school can have sessions relevant to kids on these areas. Youth meetings can address problems of drugs and sex and suicide and all these problems also. Men's fellowship can talk about how to be better fathers. Women's fellowship can talk about that. You get it. So we can incorporate this if the leaders are on board. That's one. The other area, I think, is we need to get back to Bible study and church history as major parts of the church teaching. The problem, I think, is a lot of the activities we do in church tend to be very activity oriented. Let's do this charity program. Let's do this. Let's go and conduct this free camp. Which is good. We should not take away from that. But alongside that, all these parts of the church, these various sub-parts of the church need to also get back to serious Bible study and including a little bit of church history also as part and theology and all as part of their teaching. That is a big lacuna now. It has really come down. In a lot of churches which we encounter, there isn't a lot of teaching because they think, oh, these kids will get bored, especially for young kids. Kids will get bored, and not only young kids, youth also. They'll get bored, they won't do and not. But funny thing is, we are expecting these youth to learn calculus and, we are expecting them to learn coding and all sorts of difficult things, trigonometry and all. And they're not supposed to get bored there. But suddenly when it comes to opening the Bible or talking about theology, they should not get bored. So I think it's largely the adults. We adults have this misconception that kids and youth will get bored. But our experience in general is that kids and youth are really hungry and they will enjoy good teaching. So we should, without fear, take on these difficult topics and Bible studies and theology and history discussions and all with kids and youth, because they can tolerate them. Not only tolerate, they can thrive in them, and they are the next generation of the church. So I think that's one key area which we can try and work with. So these are just two things. More are there, but I'll stop with that because we're out of time. Yeah.